Hello, I'm Emanuel Christ, Head of Interdisciplinary Endocrinology at the University Hospital in Basel, Switzerland. On behalf of my colleagues Beverly M.K, Gudmundur Johannsson, Yutaka Takahashi, and Martin Bidlingmaier, I would like to invite you to our upcoming webinar entitled Replacement Therapy with Long-Acting Growth Hormone in Adult Hypopituitarism. Dr. Biller and I have the privilege of chairing this session together. During the webinar, we will discuss the rare condition of adult hypopituitarism, which results from the deficiency of one or more hormones of the pituitary gland or from diseases of the hypothalamus. Symptoms, diagnosis, and treatment of hypopituitarism depend on which hormone are lacking. It can develop suddenly after surgery or injury, or very slowly over several months or even years. Patients with hypopituitarism face a range of challenges that significantly impact their quality of life. These challenges include fatigue, decreased exercise capacity, sexual dysfunction, infertility, depression, and anxiety. Managing hypopituitarism often requires lifelong hormone replacement therapy, which can be a major challenge for patients. This is also why it is so important to have efficient treatments that help patients with their symptoms and prevent complication, ultimately improving their quality of life. Now my co-chair, Dr. Beverly M.K, will give you an overview of what our experts will cover during this webinar.
Hello, I'm Beverly Biller, an endocrinologist and professor of medicine at Harvard Medical School and a faculty member in the Neuroendocrine and Pituitary Tumor Clinical Center at Massachusetts General Hospital in Boston. I am very fortunate to be joined by such esteemed colleagues. Together, we will present some clinical trial data and discuss best practices for the initiation and maintenance of long-acting growth hormone, or LAGH, using patient cases. First, Dr. Johannsson of the University of Gothenburg, Sweden, will summarize the clinical development of LAGH, including key efficacy and safety data from recent clinical trials. Second, Dr. Takahashi of Nara Medical University in Japan will present the clinical data on the effects of LAGH on glucose metabolism in adult hypopituitarism. Then Dr. Bidlingmaier of Ludwig Maximilians University in Munich, Germany, will discuss the profile of IGF-1 with LAGH, providing recommendations for IGF-1 guided dosing and monitoring. And I think once we have access to LAGH, this will be one of our biggest questions. He's terrific at explaining it. Finally, we encourage all attendees to actively participate in a case-based panel discussion and question and answer period, where we look forward to addressing any questions you may have. We hope you will join us for this exciting event. Thank you.